Hello guys, welcome to Doctor Academia. So today will be my second episode of OPD series, that is none other than leptospirosis. So thinking about leptospirosis, the first thing that comes to our mind is actually the little creature that runs around the house compound. That is none other than rodents. So rodents is very important when discussing leptospirosis. Why is that? Because rodents are actually carriers of some organism that causes leptospirosis. So what are these organisms? These are leptospira interrogans. These are the main culprit of causing leptospirosis. So how do they look like? This is an image of leptospira interrogans. So how do you get this image? Is actually via dark field microscopy. We can see these organisms through dark field microscopy, and these are gram-negative spiral organisms. And what is characteristics in the morphology is that you will be able to see shepherd hooks at both of the ends. So while discussing about these looks of leptospira interrogans, there are actually some organisms that look actually slightly similar to this. So what are they? So these three organisms actually look a little bit similar, but there are differences. So if you see Borrelia, these coils are actually a little bit apart. Leptospira, there are shepherd hooks. Then in Treponema pallidum, that causes syphilis, has coils a little bit nearer to it. So if they ask this question in your exams, you should be able to differentiate between these three organisms. So epidemiology, how do we get leptospira infection? So there are groups that are at a very high risk, which include sugar workers, rice field farmers, butchers, and during floods. So how do you get it? So rodents being the carrier, they excrete, they urinate on the water bodies where they see. So their excreta get mixed up with water bodies. Domestic animals may drink or may bath on these water bodies and they get infected. And these domestic animals or pets which live near our which live at our houses infect the water bodies that we commonly use, and it gets contaminated. And this organisms enters our body to ablation or injuries and causes leptospirosis. So this is a cycle that shows that how we get leptospirosis, but these are indirect contacts. There are cases where we get directly from the rats if the whole place is infested with it. So if we get infested, what kind of symptoms that we show? Let's see about that. So 90 to 95% of times, mostly the people comes with the complaints of fever, chills, myalgia, congenital condition, nausea and vomiting, and jaundice. But there are cases, that is the last 5%, where you get complicated cases of leptospirosis, which is known as Wales disease. So Wales disease means that leptospirosis, which is complicated with jaundice, renal impairment, and hemorrhages. So between hemorrhages, that means the platelet count would be pretty low. If it is jaundice, the patient will have elevated levels of bilirubin, SGOT and SGPT will be elevated, and if it is renal impairment, the creatinine and urea will be elevated. And acute kidney injury, which is most of the times the patient will be needing hemodialysis for survival. So it has a very high mortality rate also. So it is very important that you must detect all these symptoms when a patient comes with fever and chills and has a high risk of leptospirosis. So in OPD, you should always be careful about detecting it. So how we detect it? Let's see what that is. So investigations, how we diagnose it. Mostly we can diagnose it with serology. So antibody appears in our blood in the first end of the first week, in our CSF in the first and second week, and the urine it is positive from the second week. What is the most common serological test that we use? That is the microscopic agglutination test. This is actually very important because it is asked in neetpg like twice or thrice. So you should be always be ready to answer it. It is very important. So there's another medium known as EMJH medium. So the thing is that if when you use this EMJH medium, you should be able to see a ring of growth just beneath the surface. This ring is called Dingerson. So it's a very interesting test. You should be able to remember it. So how you treat a case of leptospirosis? When a case of leptospirosis come to you, you have to give some medicines to act on it. So what we normally give is that IV crystalline penicillin that we normally give for IV patients and tap doxy, which can be used as both treatment and prophylaxis. So while talking about treatment, there's a reaction I want to talk with you guys. That is nothing other than the Jalisch hexamer reaction. So what is it? So when we give treatment to the patient with leptospirosis, within 24 hours, the patient will start having symptoms like fever, chills, hypotension, tachycardia, and rashes around his body. So why does it happen? So when you start giving treatment, the spirochetes undergo lysis and release cytokines, and these cytokines actually cause all these kinds of symptoms. So even after giving treatment, there is a chance that uh, patient can go into complication. So for that also you should be careful of it. So this is a topic I want to discuss with the leptospirosis, and thank you, you guys.